Hi, Dr. Arland Hill, and today let's talk about the 3 types of interpretation when it comes to micronutrient testing. Number 1, we want to look at individual nutrients. Now, this is a starting point. In fact, this is where most practitioners start out when it comes to interpreting the micronutrient test, and this is where I ultimately began many years ago, and it's a great stepping stone into the other 2 forms of interpretation we're going to be talking about. Let me give you an example when we talk about looking at and interpreting individual micronutrients, and I want to give you some examples as well. So first off, when you're looking at an individual micronutrient and interpreting that, there's a lot of benefit to that, but there's also some weaknesses to this as well that we need to understand. What are the benefits to only looking at a single micronutrient? Well, first of all, looking at an individual micronutrient in some scenarios can tell you exactly where a patient's weaknesses are, where their overall state of dysfunction is at, and where a primary point of your treatment intervention needs to be focused at. Let me offer an example here if I may. Chromium. Almost any practitioner is going to respond that chromium is related to blood sugar. Therefore, if we see someone that has a chromium deficiency, we know without looking at any other nutrients that blood sugar is going to be a primary point of focus for us, and that's going to offer some very specific types of recommendations for supplementation, for dietary recommendations, for exercise and lifestyle intervention. Just from that one deficiency, we can set up a very extensive treatment protocol for that patient. But this is one example, and it's one nutrient. And there are other nutrients that have the exact opposite type of interpretation when we're looking at them individually. Let me offer an example here as well. Vitamin D. Vitamin D, if you've looked at any of the research on vitamin D, and you don't have to look very far to realize that vitamin D is involved in a number of different mechanisms in the body. It's involved in everything from immune function to gastrointestinal health to cardiovascular function and many more. Looking at a vitamin D deficiency doesn't provide a lot of insight in terms of where the overall state of dysfunction for that individual is. Is the patient going to benefit if we replete vitamin D? Absolutely, unquestionably, but we just aren't able to set up as extensive of a protocol if we only look at vitamin D. So where does that lead us? It leads us into the second type of interpretation, which is looking at synergistic nutrient associations. These are nutrients that have the possibility of having nutrient-nutrient interactions with each other. One of the most common examples of this is going to be the relationship between B12 and folate. We understand that both of these nutrients are necessary for a process we all appreciate now, methylation, but we also understand that if we supplement one of these 2 nutrients more aggressively than the other, we run the risk of creating a deficiency in the one that we didn't supplement. For example, if I over-supplement folate, I run the risk of creating a B12 deficiency, and the inverse is true as well. But this is not unique to B12 and to folate, but it does apply and suggest that if we look at these synergistic nutrients together, we can begin to understand how to set up better protocols for these patients. Back to my example of B12 and folate, we would know that looking at this deficiency or these 2 pairs of deficiency would suggest I need to isolate what is challenging this patient's methylation issues. Is it a detox problem? Is there an increased state of inflammation and oxidation that's promoting cellular damage that needs to be addressed such that we're not creating so much demand for DNA methylation? These would all be possibilities that would challenge or create an increased demand for these nutrients. The third way of looking at this interpretation process and where we ultimately want to evolve to, this is really the top tier of the interpretation process, and that is looking at nutrient deficiency patterns. And what nutrient deficiency patterns does is it takes a collective of nutrients And it looks at how all these nutrients interact and function together and how they're associated with specific systems in the body. Let me take an example. I mentioned chromium earlier. What other nutrients might I see with chromium that would truly confirm to me that I have a pattern of dysglycemia for a patient? Well, we would likely see zinc deficiency. We would likely see a magnesium deficiency. You may see vitamin D associated with that as well. What this is telling us is how far entrenched this state of dysfunction has become for this patient, and also it takes a long list of treatment interventions and it narrows that list down for us. It allows us to be able to decipher, do I simply select chromium for this patient with dysglycemia and use that as their primary therapeutic, or would this patient benefit better from a combination product that incorporates a multitude of nutrients in and isolates multiple metabolic pathways? It's not going to just fix that one gap, that one breakdown in their overall metabolism. It's going to address the entire system for this patient and fix all of these deficiencies. This is oftentimes why patients fail when they try things. We don't want to try. Obviously, if you're looking at the micronutrient test, you're steering your patients away from the thought process of trying. We want to be pinpoint. We want to isolate deficiencies so we can provide unique solutions to that patient and address what their specific issues are. Being able to determine, is it chromium, zinc, inositol, thiam, and niacin? Are all these deficiencies relevant to that patient? If so, we need a combination product. And dysglycemia is by no means the only pattern we can look at. In fact, there are frankly numerous patterns that we can associate here. But just to give you some of the more common, we'll break all of these down and talk about each one of these. But dysglycemia, oxidative stress, adrenal stress, a number of ways to say that, endocrine dysfunction. These are all some of the most common patterns that we see, and ways that we can easily, by looking at the micronutrient test, there are ways that we can easily isolate these and allow you to set up efficient protocols for your patient to start to get them results. But again, we're going to break all of these patterns down for you. Stay tuned. That's going to be coming up soon.